Hi there. Thank you for joining me once again on the program, Your Doctor and COVID. We continue to speak about the COVID-19 pandemic. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Today I'm wearing my mask as usual, and it's covering both my nose and mouth, but I'll take it off using the straps around my ears so we can continue this conversation. I'm putting no one else at risk here, and I myself am not being put at risk because there is no one within 6 feet of me. The COVID-19 continues to wreak havoc across the world, and in Guyana we are no exception to this. We have not been spared. It continues to claim the lives of Guyanese and those of us who have families overseas. Unfortunately, there are families overseas as well who have lost loved ones of Guyanese heritage. The sad thing about a lot of this is that people are not able to travel. People are not able to go and comfort their loved ones in person. And that's what makes this entire thing so devastating. It's happening so quickly, and we're not allowed and not given the opportunity to have the normal grieving process. To those who would have lost loved ones, we want to offer support in whatever way we can. And in a country like ours, that is so small, people know each other, it is important that we continue to stick together. Neighbors supporting neighbors, family and friends, etc. You may not be able to go physically and be with the people, but at least you can share thoughts, you can call, you can express your sympathy in one way or the other. So across the world, this thing has been ongoing for more than a year. And so far, we have almost 160 million people, 160 million people infected with COVID-19. And that's a big number, because if you remember, Guyana's population as a whole is less than 1 million. We have about 800,000 people in Guyana. So across the world, there's been close to 160 million persons infected with COVID-19. Of those people, there have been a large number of deaths associated with COVID-19. And this is more than 3.3 million people worldwide that would have died from COVID-19 infection. The number of recovered persons was about 137 million and counting as of today, and that gives us a recovery of about 86%. And that's across the globe. The number of daily new cases is also very interesting to look at. And if we look at the worldwide data, we can see that there was a first major peak that occurred sometime in November, December last year. And that showed a little bit of relief as we got into late December, early January and February across the world. But unfortunately, as we got to March and April, there is a sudden spike or another peak in the number of daily new cases as well. This is not Guyana, this is across the world. Of course, the number of positive cases also closely is mirrored by the number of deaths. And we can see the same pattern playing out across the world. There's a peak in the daily deaths around November, December, January time. There was a little fall in February, March, and then again another peak in April going into May as well. This is worldwide data, and it shows us that the world is experiencing a second deadly spike in number of cases as well as number of deaths from COVID-19. So we have to be extremely careful, extremely vigilant in order to prevent infection as well as prevent death from COVID-19. In our situation in Guyana so far, we have just over 14,000 persons testing positive for COVID-19. That's 14,000. And these days, it is quite common to see the number of positive cases daily over 100 cases per day. I believe one of the most explosive days we saw 160 cases that were confirmed as positive. Unfortunately, in Guyana, we would have had over 325 persons dying already from COVID-19, and we have 12,200 persons recovering, just about the same percentage of recovered cases that we have seen across the world. So Guyana is no different statistically from the rest of the world when it comes to cases that have recovered from COVID-19. If we look at the active cases in Guyana, we can see the same pattern playing out here that has played out across the world. An initial spike that occurred sometime in October, November last year, 2020, and now as we got into 2021, once we're into March 2021, there's a sharp increase in the number of active cases. And now that we're approaching the middle of May 2021, we are still climbing. And this is actually a very big cause for concern in this country. The number of deaths as well continue to increase. And if we look at the graph that shows us the death rates in Guyana, it is important to note that from the time this pandemic started, let's start our counter from March 2020. It took us almost from March to October 2020 to get to 100 deaths. So that's about 7 months. Then the next 100 deaths occurred somewhere from October to February. So that's an additional 4 months to get to the second 100 death. And the third 100 death, we got there from March to May. So that's only 2 months. So the rate of death has been increasing. It is taking a lot shorter time to achieve milestones of 100 deaths. And that is indeed a cause for concern, and people need to be vigilant in order to prevent the infection and, of course, to monitor their friends and family for signs and symptoms in case they become sick and they need to have medical attention. So oftentimes we seem to be comparing ourselves to our friends, our neighbors in the Caribbean. And I want to just spend some time to look at the situation that is happening in Trinidad and Tobago, which is just across the Caribbean Sea from us. And we share many similarities with Trinidad and Tobago. Culturally, and other historic similarities exist between our two countries. Now remember, Trinidad has been in a lockdown scenario since the beginning of the pandemic. So over a year now, Trinidad has had a lot stricter lockdown guidelines than Guyana. And so let's look at what has happened in Trinidad. So far, they have just about 13,400 positive cases. This is in comparison to 14,000 cases in Guyana. They have 215 deaths, and they have recovered just over 9,000 persons. So that is the raw number for Trinidad and Tobago. If we look at the graph that represents the total number of cases, you would see that for most of 2020 until August, Trinidad did very well. And then from August to October, there's a sharp rise in the number of cases. Between October all the way into February, there was a slow but steady rise in the number of cases. But then something happened in April of this year. We're not quite sure what it was, if it was some celebration that occurred around the Easter time or their traditional carnival season. We don't know if people, unknowing to the authorities, had parties and gatherings or what happened. But we have seen a rapid increase in the number of cases in April and May of 2021. And of course, the number of positive cases are closely mirrored by the number of deaths in Trinidad. So this is not surprising because this is very similar to the pattern that we have recognized across the world. We see that the deaths in most of 2020 until August and September were fairly well under control. But if we look at what has happened in the last couple of weeks, there's been a tremendous surge in the number of deaths that are seen in Trinidad and Tobago. In fact, this has prompted the authorities in Trinidad to make some drastic changes in their guidelines and how they would be managing curfews and lockdowns, etc. Remember, they've always been in a lockdown situation. And it's important when one considers the possibility of implementing lockdown strategies in Guyana, we need to have the right evidence that shows us that it works well and this is the right thing to do. Across the world, lockdowns have been used by healthcare systems to prevent that overburden, that overwhelming surge that cripples healthcare systems. Luckily in Guyana, even though the numbers are high and the numbers are alarming, we still have a fairly good reserve capacity within our healthcare system. We hope never to have to use them, but it is good to know that the reserve capacity in terms of physical infrastructure at least still exists and it's there. Right now we have 52 persons in the COVID hospital at Liliendal, and of those 52, 14 persons are actually in the COVID ICU and 2 persons are intubated. We do have a lot more capacity for beds, etc., but hopefully we will not need them, and we continue to be grateful to the workers at the Ocean View Liliendal facility and indeed across the country, Guyana, for all of the healthcare workers who have been going at this COVID-19 pandemic since it started in Guyana. Many of these people have only been managing COVID-19 patients. So at this point, one can safely consider them as experts in their field. And this is an expertise that would have been garnered from hard experience. That is not just reading and academics, but this is actual experience that my healthcare colleagues have gained to become experts in this field. And today marks the International Nursing Day, and I want to take a special second to congratulate and wish all my nurses across the length and breadth of Guyana a happy Nurses Day. Coming back to what's happening in Trinidad and Tobago as well, we see that the active cases is very, very similar to what's been happening across the world. But more importantly, our friends across the Caribbean Sea seems to have a vertical spike in the number of active cases from the beginning to the end of April. And that's a very frightening development because they are recording sometimes 200, 300 positive cases per day. We wish them well, and we continue to offer whatever support we can, not just to our friends in Trinidad, but across the Caribbean. Remember, we have a much better supply and infrastructure for vaccination at the moment. And even though we received an initial assistance from the government of Barbados in vaccines, we have also been assisting our Caribbean brothers and sisters with their vaccination program as well. So I hope you would have gotten some idea of where we are in terms of the numbers, not just in Guyana, but also in Trinidad and as well around the world. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me today.